Ukrainians will soon be seeing reforms in their state healthcare. Changes such as choosing their own doctor will be coming into effect on April 2nd. One clinic in Kiev is already prepared for the reforms. Kiev resident Natalia doesn't get sick often, but she does battle with high blood pressure. She's already used the reforms to go to her favorite doctor.
There's a very good doctor working in my neighborhood, and of course I want her to become my family doctor. She's young, she's an interesting person, and she's highly educated. I think so, judging by the recommendations she gives. By her confidence. I like her as a person and as a good specialist.
Medical workers are also preparing for the new standards. The deadline for all reforms to be implemented is July of this year. That is when the new system should be fully functional. At the moment, it is still in the stages of testing. Another facet of the medical reforms is the signing of a declaration or an agreement between a family doctor and a patient. The declaration will include certain responsibilities for various medical professionals. Therapists, pediatricians, and family doctors will monitor the health of their patients, as well as diagnose and treat for the most common diseases. They will also monitor the health status of patients with chronic diseases. If necessary, doctors will make home visits. Reforms have also placed a cap of 1,800 patients for one family doctor.
Signing the declaration is not a simple formality. It's a matter of choice. You choose your family doctor, the person who will keep your medical records and who will help you if you fall ill or even if you are healthy. The doctor will know your personality, he or she will know your medical history and your needs, and this will help to build trust between the doctor and the patient.
Ukrainians will also stop paying for medical procedures once the reforms are fully implemented.
Now we're implementing the system where the money that the state grants for medical expenses follows the patient. This means that you will show the state when and which doctor should be paid to provide medical assistance. I realize that the process of implementation can cause certain level of discomfort. It won't be easy, so it's important for everyone to be patient. And in the end, we'll get a high-quality system.
The next stage of reform is the creation of contracts between medical institutions and the National Health Service, says the head of the newly created department. It is this service that will transfer money to medical institutions for each patient.
The patient will receive primary medical care within the specified list of services. This means that the person moves away from the situation when everything is supposed to be free, according to the Constitution, but just doesn't work. Now, every patient will know what specific amount of services he or she can get, guaranteed by the state for free.
The list of therapists, pediatricians, and family doctors can be seen on a new website. This national electronic system was launched in June of last year. Since the introduction of online records, more than 1 million Ukrainians have signed up for an appointment with a doctor of their choice.